May is Mental Health Awareness Month, as we have been discussing on this broadcast. So if you're ready to take your own mental health to the next level, you have likely thought about therapy.
That's right. And finding the right therapist can be a job all unto itself.
Yes.
Good for us. We know someone that can help. Joining us now is psychiatrist and mental health expert, Dr. Gail Saltz. It is wonderful to see you.
Hey, it's wonderful to be with you guys.
We're so happy you're here. We were just discussing in the commercial break. This is something that we love talking about because we feel it's very important. I think we're both very open about it. You know,
100%.
No matter where you are, who you are, life can be tough, and everybody kind of like rides the emotional roller coaster.
Absolutely.
So we have so much to discuss with you. But let's start with therapy. And if you are someone who's feeling some type of way, how can it help you?
So talk therapies allow you to basically change your brain. They help you gain insight into your thought patterns. So when you have maladaptive, what we call maladaptive thought problems, thoughts that are causing you to behave in a way and feel in a way that isn't working for your life at work or in relationships.
Yeah.
Therapy allows you to change thoughts, which change behaviors, and have insight into past issues that influence current issues, and overall reduce suffering, whatever kind of suffering you're having.
So what are some of the signs that someone needs therapy? Because I think the last person, not always, I had a best friend in college who was like, Kestrudels, you need to go to therapy. And I was like, you're crazy. All Puerto Ricans come from crazy families. And so I had to come to it on my own.
Yes.
She saw it before I did.
Yes.
So
that's often the case, by the way.
Yeah.
When you are suffering, you don't necessarily have insight into what's happening with you, and
Exactly.
sometimes someone else needs to tell you, I see you're suffering. And that's a good way to tell someone, actually. But first of all, let me say, anybody can benefit from therapy, okay? You don't have to need therapy to benefit from therapy. So I want to say anybody can go to therapy and have benefits. But that being said, there are certain things that actually would make you say, I do need to. And they are commonly signs of clinical depression. Feeling sad most of the day, every day for weeks at a time, losing appetite, unable to sleep, not able to concentrate, not having any libido, not enjoying anything anymore the way you used to, or signs of an anxiety disorder, feeling worried most of the day, every day for weeks at a time, feeling jittery, nervous, having palpitations, feeling nauseous, having it shrink your world because you're afraid to go out and do things because you anticipate them not going well.
Wow.
There are many different kinds of issues. Those are the most common that tell you, hey, there's something going on with me. I really should check in with a mental health professional and get an evaluation.
Yep. And to that extent, how do you know if you might need to go to a therapist or go the route of a psychiatrist?
Well, let me importantly tell people that therapist is a non-regulated term. You don't have to have a license or an education of a particular sort to call yourself a therapist. But people who do therapy, and therefore are therapists, are often a social worker, a psychologist, and those are people that do psychotherapy. Psychiatrists, like me, went to medical school, did their training, can prescribe medication. And that is an inherent difference. But I will also tell you, psychiatrists like me can also be, for example, I'm a psychoanalyst, can also do psychotherapy. So that's sort of the delineator, but therapist is not enough for you to know.
Right.
You want to know what is their credential that helps them do the kind of therapy they do.
And is that part and parcel for what we should be asking when we are looking for a therapist?
Yes, you should be asking.
What are your credentials?
Exactly. You should be looking. You can look at that, or you can ask them off the bat. What are your credentials? What kind of schooling did you have? What kind of therapy do you do? What kind of experience do you have? What kinds of things do you typically treat? Right, because people specialize in different areas. I'll go on to say other things about things you should look for. Can you afford this person? Are they having availability? Are they proximal to you so you can get to them often enough? Do you have a good connection with them? When you sit with them, do you feel like you can be vulnerable? Because therapy can be hard work.
And you can audition them and say, you know what, this isn't working out for me.
Right, absolutely. People think I go to somebody, I'm stuck with them. Absolutely not. If you sit with someone and they're not active enough for you, or you don't feel like you can really trust them, or you don't feel comfortable, you don't feel like you're having that
like
relationship, that's
connection,
right. It's a relationship and it's going to last a while. So if you don't feel that, try somebody else.
And they will not take offense to it.
That's right. That's right.
So how long, once you find the right one, how often are we going? And then how long should we be going?
Right. So it depends a little bit on the modality of treatment that you're going to use. So for example, if you're going for cognitive behavioral therapy, I'm looking at my thoughts, I'm looking at my behaviors, it's usually shorter term. So maybe like, 10 sessions, 20 sessions, and you might go once a week. But if you're doing something like psychodynamic psychotherapy, looking at your past and how that's influenced where you are now, that could last longer. Most people do go once a week, I will tell you, but you could go more frequently if it benefits you, and in some instances you might go less frequently.
Right.
Okay.
Chock full of information, I would say.
I know.
100%.
Thank you for helping us, get
Yeah.
rid of some of the stigma around that.
100%.
My pleasure.
My goodness, you heard it here first. Thank you to Dr. Saltz. We're gonna have you back because we've just we just did
We
101.
have- This was Therapy 101.
Now
There's
we gotta go to-
102,
that's right.
103, all that jazz.
Ready for the next.
Exactly.
Thank you.
Thank you.
Thank
Thank
you.
you.